Good morning friends, I am Jyoti Ekar and today I am going to talk about the urinary system. So let's start. Urinary system is also known as a renal system or a urinary tract. The in the urinary system, the excessive ions, metabolic waste produced by body cell must be constantly removed and to prevent a toxic substances from accumulating and a poisoning of the body. Then the organs involved in our urinary systems are kidney, ureter, urinary bladder, and urethra. Then we see the functions of a urinary system that are the excretion of ions and metabolic waste or foreign substances help to excrete the waste product and foreign substances from body by forming a urine. Then the second is regulating the blood volume. Then maintain a ionic composition of blood. In an ionic composition, the ions involved in that are sodium, calcium, potassium, chlorines, and phosphate ions. Then it helps in regulate blood pH, that is the homeostasis of blood. Then it helps in regulating red blood cells. Then it helps in a synthesis of vitamin D3. It helps in synthesis of calciferol. Then we see the components of urinary system. Components of urinary system, first we see the kidney. Kidney is a bean-shaped organ that is present just below the rib cage, uh, uh, just below the rib cage. They are well protected by muscles and fat cells. Then it is a kidney is roughly size of our fist, and the in male the kidney is typically bit larger than a woman kidney. Then the adrenal gland is just present just above the kidney. It helps in produce aldosterone hormone, and it is helps in sodium reabsorption. Then second is a ureter. Ureter is a narrow passage for urination from kidney to it is connected from kidney to urinary bladder. It helps in urination. And then ureter is involuntary and it is made up of a smooth muscles. If urine follow up, it is allowed to stand still, and then the kidney infection will be caused due to this. And then we see the urinary bladder. Urinary bladder is made up of a transitional epithelium. It is a triple shaped in a structure. Then emptying of bladder through urination is known as mixturation. Then adults store about 2 cup of urine for 2 to 4 hours. The condition incontinence is a condition where the person can't stop urine, and it is commonly occurs in children and old age people. Then in a urinary bladder, the sphincters muscles are involved. There are two types of sphincters, that are the internal sphincter and external sphincter. Internal sphincter, the both are prevent leakage of urine in another part. Then we see the in urinary bladder, nerves are also present to alert a person when time to urination. They carry message of contraction and relaxation of a urinary bladder to urinary bladder. Then we see the urethra. Urethra is a common passage for urination. In male, it is common for semen and also for urine. And then we see the urine formation mechanism. In urine formation mechanism, each kidney contain of 1 million teeny nephrons. Then glomerulus is a site of filtration. The arterioles divides, then it is known as arterioles. Then veins divides is known as venules. The urine formation mechanism, there are 4 steps, that is a glomerular filtration, tubular reabsorption, tubular secretion, and tubular excretion. On how body is hydrated, the water in a tubules is selectively reabsorbed. Uh, then our body is hydrated. Then we see the characteristics of a urinary system. In that the component involved, that are the 93 to 97% water, the nitrogenous waste, and unneeded substance. Then second is a volume. The volume is about 700 to 2000 ml per day. Then the color of urine is a clear and pale deep yellow color. Then the smell is slightly aromatic and ammonical odor. Then the pH is slightly acidic, in that is the 4.5 to 8, average 6, but it will be changed with the what we eat. Then the each disease or disorders of a kidney is comes under nephropathy. There are many conditions in there. We see one by one, that is a nephrolithiasis. Nephrolithiasis is a kidney stone are a hard deposition of mineral acids and salts that stick together in a concentrated urine. Then second is the dialysis. Dialysis means to remove a waste product from or a excessive fluid from a body when a kidney stop working properly. Then we see the enuresis, means involuntary release of urine, most often in a reference to a bedwetting. And disorders involved in, that is UTI, urinary tract infection. When a bacteria enters into a urinary tract, they can affect the kidney, ureter, urinary bladder, and urethra also. While the UTI is common in a woman's, and they also occurs in male, but in small condition. Then second is cystitis. Cystitis is a bladder infection. Then next is a kidney stone. Kidney stone, this can cause due to a high level of calcium in a blood. Then urinary incontinence means can't stop urination, but it commonly occurs in old age peoples and children's. Then enlarged prostate, means it is a common in old age peoples, and it make it difficult to emptying the bladder. Then glomerulonephritis is a inflammation of glomeruli, which is a teeny filters in a kidney. We see overreactive bladder. Overreactive bladder is a condition where the bladder squeezes urine out at a wrong time. Then prostatitis means prostate inflammation. Then nocturia, it means the frequently getting up and urinating during night time. Then we see the diagnosis. In diagnosis, there the analyze urine sample, CT scan, MRI, ultrasound. Then cytoscopy. Cytoscopy means a method to examine the urinary bladder and urethra. Then in diagnosis, that is a ureteroscopy also. Then urodynamic testing, to make to take a water and check how much urine we hold Then last is immunomodulators is also given for treatment. Then lithoscopy and lithotripsy also is a diagnosis in which the kidney stone break with the help of UV rays. Uh, Thank you.